The most common problem that I take care of as an otologist and as a neurotologist is chronic otitis media, and that basically is chronic ear infections that occur in people sometimes starting early in their life, even in childhood. Treatment for otitis media typically is medical with use of antibiotics, but when people get into recurrent infections, they can actually get changes in how their ear normally functions. And there's also a secondary problem called cholesteatoma, which would be when skin gets into an abnormal place and it's sealed off from exposure to air, it becomes very erosive and starts dissolving things like ear bones and structures within the middle ear and mastoid. So when you look at how the normal ear works, you have the ear canal, which comes to an eardrum, which sits right here, a tympanic membrane. The middle ear space actually houses the ossicular chain or the ear bone chain that conducts sound to the inner ear. So chronic otitis media is really a problem of the mastoid behind the ear in the middle ear space. Usually people will have abnormalities in the absorptive and pressure equalizing function of the mastoid that then overwhelms the auditory system to where the eustachian tube can't keep up. And what happens is when you look at the eardrum, the lower 2/3 actually has 3 layers. The whole eardrum has an outer skin layer. It has an under mucosal layer, which is somewhat secretory. It releases fluids, it absorbs gases. And for the lower 2/3 down here, the eardrum or tympanic membrane has a middle layer that is the tenacity of Gore-Tex. It's very strong. It gives the eardrum structure. So when you get negative pressure in the middle ear system, in the mastoid system, what happens is you start getting retraction or sucking in of the eardrum. So this upper area, which we call the pars flaccida area, will retract first. And when that retracts, it gets stuck down on the heads of the ear bones. If that continues, you can get a large sac going up into the mastoid cavity, and that forms what we call a cholesteatoma. You can also have cholesteatomas that are a product of just abnormal tissue that was put in your ear before you were born. That's called a congenital cholesteatoma. We manage them very similarly, but their disease process is somewhat different. So there are multiple layers of managing this. The first is, which you see particularly in young children, is the use of ear tubes, tympanostomy tubes. So we'll put tubes in, equalize pressure, get them over their chronic infections, resolve the fluid, which gets rid of a conductive hearing loss that they deal with, particularly in times in the first 2 to 3 years of life when they're acquiring language. Those ear tubes are very important. Most people will do well with a set of tubes or just being treated medically and they have no further problems. Then there's a smaller contingent of people who continue with middle ear and mastoid pressure problems, and they will generate this chronic infection. And what ends up happening is we have to anatomically change the ear with surgery so that we open the mastoid or the sinus of the ear. We open that up to the middle ear so that it can equalize as one system around pressure and fluid absorption. And so that would bring in to picture either a tympanoplasty, where we repair the eardrum. We can use various tissues to do that, all within the body. When there's cholesteatoma involved, it's not just about reestablishing gas and fluid flow in the middle ear and mastoid. It's also about removing that cholesteatoma, making sure it has no chance of recurring, and then reconstructing any damage to the ear bones that occurs. So you'll hear the terms mastoidectomy and tympanoplasty. So a mastoidectomy, we don't remove the mastoid from the side of your skull. We open it up and we wash it out and we make sure that it's in continuity with the middle ear so that your ear can function normally. That would get rid of things like popping. That would get rid of things like ear fullness and pressure. Problems that people have when they fly, only feeling those same symptoms on a more chronic or permanent basis can be resolved. So, and sometimes it's a combination. Sometimes we'll do a mastoidectomy and we'll put in a ear tube or a tympanostomy tube to equalize pressure until the system can recover fully. So mastoid surgery is typically done as an outpatient. You would go home the same day. The operations are typically an hour to an hour and a half, and we do the majority of these in one procedure. With cholesteatoma in particular, there are some cases where it's so extensive we have to remove that abnormal tissue, give the ear 9 to 12 months to recover. We go back in and take what we call a second look. Very valuable for endoscopes to be involved in the second look because we can look in every crevice to make sure there's none of that squamous or skin cells from the cholesteatoma present. Once we know that's eradicated, we can rebuild the eardrum if we need to, and also rebuild the middle ear bone chain with ossicular prosthesis to repair these ear bones. So chronic ear surgery overall is the bulk of surgery for any otologist. Again, we're dealing with chronic ear disease. So as opposed to curing it in a lot of times, we're trying to get the ear to be able to dance with it, to be able to function normally. Even though the ear may never be totally normal in its function, it can still deliver good hearing and not have more chronic infections or recurrent cholesteatoma.